Hi, I'm Sharon Davis. I'm a women's health provider at the Veranda, and today I want to talk with you about adult vaccinations. The flu vaccine is very important every year. That is available usually around the 1st of October and should be taken by, there are some people that should be excluded from that, but the majority of people are eligible to take that and can really reduce their illness and complications from illness by going ahead and taking that when it's available. There are about 200,000 admissions to the hospital for flu every year, and about 36,000 people die from the flu every year. It's not a live virus, at least the injectable form is not. And it does take 2 weeks. Once you take the vaccine, it takes 2 weeks to build antibodies so that you actually have the protection from the flu. So if you take the flu shot and you've already been exposed to the flu or any other kind of illness, or you take the flu shot and afterward you get sick, you're likely to have gotten sick from something you were exposed to during that period. The flu vaccine can't give you the flu. The CDC recommends that anyone over 65 years old should have two pneumococcal vaccines. There is a 13 and a 23, and they're usually given about 6 months to a year apart. And those are to protect from a very serious strain of pneumococcus that can cause pneumonia and lots of health care problems that can be have really long-term effects. People that have had chickenpox in the past have that virus, and then they can develop shingles later on in life. The shingles are blisters that are extremely painful, and they usually kind of happen in a pattern, usually around someone's side or back, or on their face. But it is extremely painful, and if you take the vaccine, it's usually given at age 60. Taking the vaccine can reduce the risk of that by about 50%. There are antivirals that we can give you, but that is going to work over time. It's not going to go away overnight. So there are medications, but the best thing is prevention by getting the vaccination. People who have been vaccinated or people that have had the chickenpox will still need to have the shingles vaccine. Okay, so the flu vaccine needs to be given every year, usually in the fall around October. The pneumonia vaccine should be given one time. It's 2 injections given about 6 months to a year apart, but then no more. And then the shingles vaccine is a one-time injection. During your annual exam, we would like to talk with you about vaccinations and the ones that you are eligible for, that you need, and try to get those for you to protect you against those illnesses.